This is Duncan Turner from the Vagina Doctor podcast. Welcome to the Consult With Me segment where we take a deeper look into our most frequently asked questions. But what do I know? I'm just a vagina doctor.
Okay, so exosomes, the big word right now, the hot topic.
Absolutely. Number of years ago, platelet-rich plasma was used to accelerate healing and help healing, mainly for orthopedic patients, but came over into other genres of medicine, of cosmetics and pelvic issues. This was because of healing factors which were in the platelet-rich plasma. And since that time, there's been advance in the science going as far back as stem cells. And exosomes are stem cell derivatives which carry the healing power. And they're used topically. The FDA have approved them for topical use, and they're very, very effective for that. There's a great clamor at this point to be able to use them by injection, but that's not been cleared by the FDA. So in our practice, we're using exosomes topically. These are just added on painlessly to other treatments that we're doing and really are advantageous. That it's really the healing factor that's the most profound at this point.
So right now we're using them for vaginal rejuvenation patients. We're using them after microneedling treatments, so on the face and the vagina. We're using them for hair loss treatments with microneedling.
Yes.
And I heard just the other day that you are putting together a study. So let's talk more about that.
Yeah, this is great. We've been really struggling a little bit to see exactly how best to apply them. There have been procedures we've done, such as the O shot and the P shot, which have been using platelet-rich plasma to accelerate healing and sexual function. And we wanted to use the exosomes to do that, but not being able to inject them, we've been creative in other ways. So what we're doing now is we're developing a study of patients that would otherwise be having either Mona Lisa treatments or microneedling, vaginal microneedling with Morpheus 8V. And in addition to doing those procedures, we are going to do an application of exosomes with hyaluronic acid and collagen. And the thought right now is that we're going to apply it vaginally as a mist. It will be infused into the vagina after the microneedling or radiofree or Mona Lisa treatment. And so we're going to enroll patients. We're just putting this study together and getting the details right. But we will be offering this to patients, and they will have a choice to be involved in the study or not. If they are involved in it, they will be randomly selected to a control group or an active group. They won't know which one it is. We will apply the exosomes in one way or another along with the microneedling in each of the treatments that we're doing, if there's a 3-course treatment, and we'll evaluate the data. And so this will enable patients to have exosomes at no additional cost if they're on the right side of that equation. And with controlled studies, there's always the standard, what's the word I'm looking for? The control group.
Yeah. But we'll give it to them after if they're not in that.
Oh, yeah, we will. Right.
I'm super excited about that and about exosomes in general. I mean, a year ago, we were at a conference and nobody would say the word exosome out loud. And now fast forward a year later and Dr. Pontius was at a conference and everyone was talking about exosomes. So it's definitely what's happening right now, and the healing mechanisms of them And I think it's super exciting.
Yeah. Unfortunately, it's going to be a while before the FDA approves exosomes for injectable use. And it's because it's classed as what's called a biologic. And it has to go through very significant long-term study before it's enabled for injectable use. But topically, we have methods in the office of increasing absorption through the skin, which is all allowed, either by the microneedling efforts or with the collagenizer, which increases the pore size of the skin and allows more absorption that way.
Yeah.
Lots of exciting things.
Great. Thank you.
Thank you.
Thanks for listening. And if you have more questions, please let us know either by email or DM us on the Vagina Doctor podcast.
See you in the next episode. The Vagina Doctor podcast. It all starts here.